Good morning, Chair Friedman, Vice Chair Ferrante, and honorable chairs and members of the Ways and Means Committee. Thank you so much for hearing my testimony, and thank you for your painstaking service. As Senate Chair of the Joint Committee on Public Health and Senate Chair of the COVID-19 and Emergency Preparedness and Management Committee, I'm testifying today, like my colleagues, Chair Garlick and Representative Kane, about a crisis in local public health and to request targeted one-time transformational investments that will allow us to address critical local public health needs and meet this pandemic the only way we can, by preparing for the next crisis and the next pandemic. I want to recognize and thank the honorable chairs of Ways and Means and the committee for starting this work in the past 2 years by funding local public health excellence grants at 10 million in FY21 and 15 million in FY22. These funds have made a difference. I see them working across the Commonwealth. I believe these funds have saved lives. The Commonwealth has long had, as you heard from my colleagues, an inadequate system of local public health. As you know, and as my colleagues said, the Special Commission on Local and Regional Public Health identified numerous and urgent improvements that were needed. And then when COVID-19 hit and we still hadn't sufficiently addressed the problems brought to light by this special commission, the results were cataclysmic in some cases, and the burdens inequitably borne. In an instant, we all saw the imperative of having a high-functioning local public health infrastructure, and our constituents experienced, and I would say they are continuing to experience, the perils of its absence. With 351 independent jurisdictions and no substantive state funding before the last 2 years, not enough supported collaboration, no uniform system for collecting data, uneven training, no baseline standards or minimum requirements regarding public health protections, we will never have an adequate local public health system until we make the requisite investment. And while these investments will rightly answer calls for equity as they should, they will also strengthen the health and well-being of every single person living in the Commonwealth. That's a pretty profound return on investment. Today, you will hear testimony from local health officials who had countless new life or death responsibilities heaped on them during the pandemic, on top of their already vast purview. Over the past months, with stellar leaders on this issue, like Chair Denise Garlick and Representative Hannah Kane, we've worked together with tireless Department of Public Health and local health officials and experts to strengthen the state action for local public health legislation, a roadmap, if you will, that's before the Public Health Committee. In our discussions, there's been unanimous agreement about the need for uniform baseline public health protections in every community in the Commonwealth. And here, let me say how fortunate I feel to do this work in partnership with Chair Marjorie Decker. ARPA funds are needed to help us achieve this mandate by making one-time investments in our infrastructure, both physical and IT, and our human infrastructure. As you've heard, the Coalition for Local Public Health has developed a plan for $250 million of investment in technical assistance for regionalization, workforce development and training, and significantly upgraded system of data collection, because we can't address what we can't see and measure. The committee is in receipt of this proposal, and I thank you for your tenacious review. Chairs, I urge us to learn the brutal lessons of this pandemic and not repeat past mistakes. I urge us to honor the lives of those we lost and the workforce we simply can't live without. These one-time ARPA funds came about because of a public health crisis, an infectious disease nightmare, which has consumed every facet of our lives and our constituents' lives for the past year and a half, and it's ongoing. Let's make the needed investment to keep our constituents healthy and safe, to guard against future pandemics, to build back better by fortifying our system of local public health once and for all. Thank you so much for your consideration.